According to Eric Kane in American Journal of Public Health, 2013, in 2010, suicide was the third leading cause of death for those aged 15 to 24, second among those aged 25 to 34, and fourth among those aged 35 to 44 years. So what does this all mean? Those numbers are of epidemic proportions. My speech is not about death, though. My speech is about living. I hope to convince you that suicide is a very preventable cause of death, and suicide prevention is a skill everyone can master. I understand suicide is a touchy subject to most people. Suicide is a very stigmatized and taboo subject in this country and around the world. But my experience with suicide and through proper research tells me that the tragedy, which is suicide, can be combated by anyone with gatekeeper knowledge. This knowledge is known as QPR, an acronym for Question, Persuade, Refer. I have been affected by suicide many times in my life. I was once suicidal myself. I have had 2 uncles commit suicide and 3 friends. I now work at the Department of Veterans Affairs, and I work in the Suicide Prevention Office. I travel to military bases and give my story to soldiers. Suicide prevention is a very passionate subject to me. I'm going to map out the techniques everyone can apply to someone with suicidal warning signs. This gatekeeper knowledge begins with knowing 4 important facts. 1. It is imperative to know the warning signs of a possible suicidal individual. 2. Suicide can be prevented by simply asking a question. 3. Suicide can be prevented by persuading someone to get help. And 4. Suicide can be prevented by referring someone to a helping professional. Let's start by reviewing what to look for in someone in distress. Many people often give warning signs during the week preceding a suicide attempt. Suicide, in its simplest terms, is a solution to a problem. According to Paul Quinet in QPR Handbook 1995, thoughts of suicide occur during times of personal crisis, unrelenting stress, depression, or when we are confronted with fear of failure or a specter of an unacceptable loss. There are almost always warning signs someone is contemplating suicide. Paul Quinet adds, clues and warning signs come in several forms, but once understood, they are not difficult to recognize. Some clues or warning signs may be acute distress, despair, or hopelessness about the future. The most direct warning sign that someone will give if they are considering suicide is they will tell you they want to kill themselves. There are indirect or coded verbal clues to watch for as well. They may say things like, "I'm tired of life. What's the point in going on? I'm tired of it all." Or, "I just wish I wouldn't wake up tomorrow." Anyone can add to this list. There may be behavioral clues to look for as well. They may begin to give their prized and personal possessions away. They may begin to get their affairs in order. They may relapse into drug and alcohol use after a time of recovery. Anyone can add to this list. There are also situational clues to look for as well, like sudden rejection by a loved one, a death of a spouse, child, or friend. Again, anyone can add to this list. Knowing these warning signs, let's now begin to look at how to address them. QPR begins by asking a question. Michael Isaac in Canadian Journal of Psychiatry 2009 says, gatekeeper training has been implemented and studied in many populations, including military personnel, public school staff, peer helpers, clinicians, and even Aboriginal people. This type of training has been shown to positively affect the knowledge, skills, and attitudes of trainees regarding suicide prevention. Large-scale cohort studies in military personnel and physicians have reported promising results with a significant reduction in suicidal ideation, suicide attempts, and deaths by suicide. QPR is a gatekeeper technique that can be of great help. Paul Quinnett contends that there are several methods to asking the person about suicidal thoughts. Asking someone the S question can be very intimidating, awkward, or even difficult. But the truth is, you may be the best person to recognize these signs and prevent suicide. Once you have the person alone or in a private setting, you may then begin the questioning phase. You may begin to ask the S question by acknowledging the person's distress. You may take the less direct approach by asking, "Have you been unhappy lately?" You may ask, "Have you been wishing you were dead?" You may even ask, "Do you ever wish you could go to sleep and never wake up?" Anyone can add to this list. You may take the more direct approach by asking, "Have you ever wanted to stop living?" But the best way and most simple way to ask is ask them, "Are you thinking about suicide?" Asking the question is the most important step of QPR. Asking is the hardest step to take, and for good reason. First, a yes to the S question puts the subject of suicide out there on the table. Second, if someone answers yes to the suicide question, we must now do something about it. If someone answers yes to the suicide question, it is now time to persuade them. The next step in preventing suicide is persuading them to get help. Paul Quinnett claims persuading someone not to end his or her life and to get help begins with the simple act of listening. Listening can be life-saving. Listen first, then persuade. Paul Quinnett gives some tips on becoming a better listener. You can start by giving your full attention, not interrupting, and only speaking when the individual has stopped. Not rushing to judgment or condemnation. Taming your own fear so that you may focus on the other person. The goal of persuasion is simple. The main goal is to get the person to say that they will get help. Paul Quinnett adds that a yes to any of the following questions confirms that you have been successful. Will you go with me to see a counselor, or a priest, minister, school nurse, psychologist, or whatever kind of professional they are willing to go see? Will you let me make the appointment for you? There is a possibility the person will refuse to get help. Involuntary treatment may be necessary. The laws of the land do not permit someone to kill him or herself. By calling 1-800-273-TALK, you can access the information and access the involuntary treatment professionals who have the authority to conduct an evaluation for possible detention in a hospital. Now that we have explored the persuasion step, let's look at what to do next. The last step in QPR is to refer them to a helping professional. Paul Quinnett gives a few guidelines to follow when making a referral. The best referral is when you personally take the person you are worried about to a mental health provider or other appropriate professional. You may find it hard to act or that you don't have the courage. Don't worry about being disloyal. Don't worry about breaking trust. Don't worry about not having the sufficient information to call for help. If you personally don't feel comfortable asking the S question, find someone who can and share your concerns with them. We are only responsible for the information we know at the time we know it. Reach out. Don't wait. Do something. In conclusion, I hope you have been made aware of the importance and ease of suicide prevention. Today I explained to you the gatekeeper training known as QPR. Question, persuade, refer. Knowing this information can truly save someone's life. If you know someone who may be exhibiting the signs of suicide or just a crisis, find the courage to act. You can do this by recognizing the warning signs of suicide. If someone seems to show the signs, simply ask them, "Are you thinking about suicide?" They either are or they aren't. There is no gray area with suicide. If they say yes, persuade them to get help from wherever they feel comfortable doing so. Remember, our job is not to be the counselor. If they agree to get help, go the extra mile and refer them yourself so that you know for sure they actually went to get help. Suicide prevention begins with listening. Suicide prevention is everybody's business. Are you going to be brave enough to save a life? Applying QPR can plant the seeds of hope and reduce the risk of premature death by suicide.